Hello. This is my review of evidence-based practice models. I have chosen to focus on families, and the theory that I have chosen to review is the Bowen family systems theory. So, describing Bowen family systems theory, clientele and populations for this modality. Something interesting in my research when I was starting this assignment was I found that, interestingly enough, there is a lot of evidence to support that this modality works particularly well for families and women struggling with infertility. I found one case study on a woman experiencing endometriosis who was experiencing infertility because of that medical condition. She went through Bowen family theory and it helped her to reduce her stress and anxiety, so much so that she was actually able to become pregnant and have a successful pregnancy despite her endometriosis. I also found another study that did a more comprehensive study on this question. It talked about how they did Bowen family systems theory on families experiencing infertility, and the study found that this modality helped reduce stress and anxiety. Obviously, not every family resulted in a pregnancy, but it did reduce the stress and anxiety surrounding the topic. So, another interesting thing about clientele and populations that this tends to work with is families who have generational trauma. And both studies mentioned both fam how Bowen family systems theory helped to deconstruct some of that family generational trauma, especially surrounding the topic of infertility and a lot of the shame that some of these families were feeling because of generational trauma. Problems and issues that are best addressed by Bowen family systems theory. According to Gladding 2019, Bowen family systems theory was created to address chronic anxiety and emotional processes in families and society. So, Murray Bowen touches on a couple of different topics here. He identifies a few key different problems and issues that his overall theory aims to tackle, and that has been kind of developed over time by multiple researchers beyond Bowen. So, first is differentiation of self, which is the ability to separate the self from one's own family. The next is nuclear family emotional process, understanding and identifying how a family has formed relationships. Bowen transmission process, understanding the family's coping skills and how they have been passed down. Family projection, understanding how parents may have passed on emotional regulation to children. Triangulation, two people in a family use a third person as a stress reliever in this relationship. And so a good example of this is mom and dad, or mom and mom, or dad and dad, or, you know, two people in a relationship are having a fight and they put the child in the middle of it. So it's divorce or separation or just fights. Child is in the middle as a stress reliever. That's very common. And it doesn't have to actually be just two people. It can also be one person. So maybe mom is inappropriately using child as their therapist, and that is not okay, and that is triangulation. Cutoffs, exactly what it sounds like, cutting off a family member to deal with anxiety surrounding the relationship. Sibling position, addressing birth order and the variation in experiences that come with that. Emotional process in society, what anxieties in the situation are coming from society and not just the family. So addressing some systems and how they influence families and barriers family faces because of systems. So Bowen family systems theory of change, it's kind of a very simple theory of change. So if one increases their differentiation of self emotional regulation, coping skills, and works to address the family system, all those things we just talked about. This will hopefully all work to decrease the amount of anxiety, experienced by the individual and the family, which will hopefully overall increase the health of the family system. So, primary mechanism used to create change. This is not technique oriented, it's way more goal oriented. As the previous goals, we go back to this slide, these are the goals. Okay. And Bowen didn't want people to get caught up in techniques, but rather focus on working towards those goals and outcomes. However, there are some common techniques used to help achieve these goals. So the first big one is genograms, which is a map created by an individual or the family to explain family dynamics and relationships and how they work, similar to a family tree, but each line is going to mean something. What is the family dynamic here? What's going on? What's the relationship? Another technique Bowen identified is going home again. In the physical or metaphorical sense, have the client go home and re-meet their family as an outsider looking in. Detriangulation. One or two people learn to stop projecting onto that other person and let go of that anxiety. The second or third person works to separate from the triangulation and decrease anxiety around that. Person-to-person relationships, just two people focus on learning positive things about each other and focus on positive conversations, not conflict, not arguments, just positive conversations. Differentiation of self, understanding yourself as a person, separate from your family. Interpersonal level, you're learning to separate your thoughts from your feelings about your family. Intrapersonally, you are learning how to re-engage with your family in a healthy way while keeping your sense of self. Asking questions, which is simply just that. Asking questions allows the client or clients to tell their story and help you find the root or roots of the problem. The last one is talk to the counselor. To avoid more conflict, encourage family members to talk to you, the counselor, and not to each other. So that way you can sort of act as this non-biased source to have information flow in between. The therapist role. It is so important that the therapist has their own differentiation in session. That means that they are calm, collected, and maintain neutrality. They stay a separate entity from the family. In the same vein, they also model this differentiation for the family. They ask questions and guide the session with questions related to the theory. Practice context most appropriate for family systems. So, interestingly enough, this theory was created for an inpatient psychiatric setting. However, it is best used for outpatient settings or community-based settings. And also very interestingly, it is equally effective amongst individuals, couples, and families. It does not just work with families, it works equally as well with individuals and couples as well. And again, there's just some more evidence to show it is actually not effective in the inpatient psychiatric setting, which is what it was developed for. There's not a lot of evidence to support that. There's more evidence to support that it's just not effective in that setting. Time frames for this modality. So as previously stated, the model is meant to be flexible and not so scheduled. It is meant to be built to fit the needs of the family. However, there is some research that suggests 50 to 60-minute family sessions are best for as far as how long each individual session with the family should last. So resources for this modality, like I previously mentioned, it's not a very structured modality. So resources, the best resources are just well-structured genograms. The book provides a couple of examples, Gladding provides a couple of examples of well-structured genograms and what that can look like. Other than that, it's important to have an outpatient clinic space or community-based setting to complete this modality in and then provide the service for, and of course, a family to do it with. So moving on to critiquing Bowen family systems theory. First, we have the strengths of Bowen family systems theory. This theory strongly addresses intergenerational habits and trauma. I put that word there loosely because, yes, it can include trauma. However, sometimes there's a reason I also put habits because some family habits can just be bad habits and that can harm the family. It may not necessarily be intergenerational trauma, it may be more individual trauma, or just maybe bad habits. It includes this topic and its process and helps the family understand and heal from habits, bad habits, trauma, intergenerational trauma, individual trauma. So, in addition to addressing intergenerational trauma, it also addresses systemic influences and barriers the family may face. The theory is also very flexible in how it is applied to every family. This also makes it more applicable and universal to families of all backgrounds as well. Limitations of Bowen family systems theory. Because the theory is so flexible and has minimal structure, it can become very complex very quickly, in that it can be hard to stick to the theory itself because you don't always have a ton of direction. It relies a lot on the abilities of the therapist to facilitate and have prior skill in this kind of setting. It's not quite as step by step. It's more about skill, playing it by ear. There's actually also not of empirical evidence available to support this theory, and I will show you in the next couple of slides what that means. But essentially, even though in theory it should apply to everyone, we don't have a lot of evidence to support that it necessarily applies to everyone. So I'll show you what I mean. So Bowen family systems theory generalization. So looking at the cultural and economic background of this theory, Murray Bowen started the theory with primarily Western European Americans with an early focus on psychiatric patients, which again is interesting because research now shows this is the least productive population to do this work with. Gender differences have also not been a historical focus, but a lot of the research overall has been done with mothers as the focus. So, at the very least, we know that mothers are receptive to this, but focus on genders, we don't have a lot of research to support that. Age, there is some research there, and it can be broadly applied. There is a lot of research showing it can be applied with families, individual children, couples, older folks. The theory can be very broadly applied to age. The original creators of this theory, interestingly enough, did not design it with families who have a disabled family member in mind, and this includes physically disabled and mentally disabled, which I think is very interesting because that is a big reason, and in my opinion, why families might go to family therapy, because they have a disabled child mentally or physically and may not know how to navigate that. It has been noted that this is just very limited for folks who are going through that and may not be the most effective theory, but again, not a ton of research to support. Overall, in theory, this theory is supposed to be very flexible and applicable, but there's just not a ton of research to show that this can be applied across gender, age, race, ability, etc. So, Bowen family systems infidelity. I think that in practice, this theory naturally draws from a lot of other theories. For example, one of the primary mechanisms of this theory is just asking questions. This is in line with motivational interviewing for me, in which you just ask a lot of questions to allow the client to tell their own story and allow them space to think out loud. I also see CBT creep in a little bit, especially in the differentiation of self. You're encouraging the individual to change their thoughts about themselves, to hopefully change their behavior and change their situation with the family and how they act around them, their anxiety surrounding them. I think because of this and because this theory is built to be flexible, then yes, it could be practice infidelity. However, because even with a super flexible theory such as this, and because we don't have a ton of research supporting just how flexible this theory can be for every family, I think realistically there are going to be times when the needs of the family will take you off track and away from this theory, or may have you not considering it as an option anymore. Especially, I think, when I was talking before about families who have a disabled, physically or mentally or both, family member in their family. So this is my works cited. I'm just gonna leave that there for a second. And that is the end of my presentation. I hope you enjoyed. And that is Bowen Family Systems Theory.